Experts are calling for supermarkets to stop stocking junk foods at high level on shelves in order to help tackle the obesity crisis. A report by the Royal Society for Public Health says that store layouts are designed to tempt shoppers into making extra purchases, most of which are unhealthy options. So, should supermarkets have, or is your diet your own personal responsibility? Well, join me to discuss this are Shirley Kramer, the Chief Executive of the Royal Society for Public Health, and consumer journalist and feature writer Harry Wallop. Thank you both for joining us today. Shirley, if I can firstly start with you, what would you say the main points in your report are?
The main reports are that when we've looked at supermarkets and looked at the environment in which shoppers are shopping, we see that actually foods that are high in fat, salt and sugar are 70% of the food that you find on the end of aisles or in really prominent positions. We also find that 89% of the food at child height is also in that category. So we asked the public what they thought, and actually the public believed that their changes could and should be made. And we would like this to be a win-win for supermarkets, but promoting healthier options rather than unhealthy options.
So Shirley, have you been able to make any recommendations?
Yeah, we made several recommendations. One is that the allocation of shelf space should go to, the vast majority of it, to healthier options, that price promotions, which have been talked about often, which are the 2-for-1s, mostly are high, foods high in fat, sugar and salt, but maybe we could have 2-for-1 promotions on healthier food. Also things like, if you are a supermarket that has a series of guidelines, and we've set out a series of guidelines that might be helpful to supermarkets to create this healthier environment, then perhaps your business rates could be cut, or certainly a proportion lower, because you're providing healthier food for the environment. It really is important because we have 20% of our children are obese, and of course these are often children want to have diabetes or cardiovascular problems as adults, and to cost themselves, it's very, it's a really hard thing to try and lose weight. Better that we help particularly children before they gain that weight.
Harry, what do you think of this idea and the proposals? Is it a good idea? Because we do have this ongoing obesity problem in this country. These suggestions and recommendations go some way to tackling that issue.
Well, I think the report's rather flawed. I mean, putting aside the fact that it's sponsored by Slimming World, in whose interest it is to make us feel guilty about not eating healthily enough, it doesn't really recognise the reality of what has actually happened over the last few years, both in the snacking industry and in the supermarket world. And if you take, say, snacks, for instance, there was an enormous boom in them in the 1970s, 80s and 90s. Back in 1996, we did eat 69 grams, each adult, every week of snacks and crisps and nuts. But that's actually fallen in the last few years, and it's now at 56 grams. And in fact, we eat fewer calories now, calories bought from supermarkets, than we did a few years ago. We are actually eating less, and a lot of that is actually down to the supermarkets themselves, who don't take credit for the fact that they now, for instance, if you go into Aldi, the first thing you see is fruit and veg, and every week they have a promotion on fruit and veg. And a lot of other supermarkets have taken snacks high in fat, salt and sugar, which I appreciate are possibly a problem, but they've been taken away from the tills to reduce those impulse purchases. So the supermarkets are already acting voluntarily on this.
Shirley, is that a fair point, that supermarkets are acting voluntarily on this? Go ahead.
Yes, I mean, we're not having a go at supermarkets in that they're the bad guys. We really don't think so. Supermarkets have made real headway, and we've worked with many supermarkets. The idea of this piece of work called Health on the Shelf, how you might provide nudges, we've called these nudges, in order to move people forward to have a much healthier lifestyle. Whatever, we have made progress, but we're not making enough progress fast enough, because we still have the heaviest people in Europe. So we still have massive health problems. And I think whatever we can do, and I know that supermarkets want to play their part in this because they've said so, and they are willing to work with us on this. What we really want is a win-win, where it's good for the supermarket and they're making profits, and it's also good for the health and well-being. And I would say a word about Slimming World because, in fact, they work with the National Health Service, and the National Institute of Clinical Excellence also work with them because they have an evidence base that they have helped people lose weight over many years.
So Harry, we are all trying to do our bit. The supermarkets are doing their bits, but we can all do more. We can all be better at this. I was looking at some OECD figures that came out in 2017, which told us that the UK is the heaviest country in Western Europe when it comes to obesity. So, clearly there is a huge issue here.
There is no doubt we do have an obesity problem in Britain. I think it's sometimes slightly overstated. Obesity levels in the UK peaked around about 10 years ago, certainly in childhood obesity that we sort of get ourselves very worried about. Obesity rates have actually fallen in the last few years, not by huge amounts, but slightly. And it seems to be no one's interested in reporting the fact that we're getting marginally less overweight or obese. But certainly it's not getting any worse. I'm all for nudges, and I think it would be interesting if, for instance, supermarkets were rewarded, be it through business rates, for selling a greater proportion of healthy foods. But there is only so much shelf space a supermarket has. People do want to occasionally treat themselves, and those have to go on some sort of shelves. So the question is where those shelves should be. Not everything can be on that key eye-level shelf, which is the most prominent shelf that a lot of manufacturers, and let's not forget it's the manufacturers who are making a lot of these products, pay to put their products.
Yeah, very interesting. And Shirley, the bottom line is supermarkets are businesses, and businesses are there to make money. I mean, what about personal responsibility? I know that when I go and do my grocery,